welcome back to the final segment of the Community Matters show. I've been talking about MAA, the Maternity Aid Association, and I've got some very sincere young brothers that have been working very hard to bring awareness of the situations of maternity, of the situations of labour in Bangladesh, which we here in England take for granted. There's been so much that we've gone through. There's like a 30-second video that we're just going to play now, which you'll probably see whilst I'm talking, and it's about the work and the promotion that they're doing. I mean, I've got the chair of the association here, Akil, with me. Akil, I mean, you guys have been doing so much just to raise the awareness, and I mean, tell me, must be knackering you out, no?
Well, with medical studies, you know, doing that on the side, a bit knackering, but I think it's worth it. The long-term goal, MAA is definitely worth it.
Yeah, I mean, you can probably see there's a video coming up in the background. I mean, Akil, talk us through this video.
As you can see, there's patients on the floor, and that's a newborn baby, and placed straight on the ground on a cloth. Like,
I'm really sorry, I should have given a warning to our viewers, but some of the stuff that are coming up, obviously they're going to be of that maternity nature. So if you're not able to handle that side of things, then I'd probably say, look, I'll give you a pre-warning. But I mean, that was a real baby just being put into what appeared to be a briefcase to me.
It was the mother's unna, so, but it was still like, that's unhygienic. You can have so much infections being passed on by just some simple things like that. Yeah. And that's really the basis of MAA, educating mothers about these simple hygiene control. Or
I mean, I'm hearing hygiene's come up quite a lot for us. Yeah. That must be like the pinnacle. That is the biggest problem, isn't it? Or is there other things that are a huge issue?
Say
because I mean, as a caller brought up an issue with finances and corruption, which, you know, that's a problem as well, as you're aware. But what would you say is the big pinpoint?
It's an interesting question, yeah. I had a talk with a consultant when I was over in my MAA trip this December, and he mentioned it was a mindset, it was education. He mentioned how young girls in Bangladesh are not taught in the syllabus about their biological, physiological changes. And it's important that it's completely tabooed. And it's important that you have doctors, female doctors, come over and tell these young women, girls, in the schools that, listen, these are the biological changes that's going to go ahead with you, and these are some of the things you should expect. But they're not taught this. The only times they're taught about this kind of stuff is maybe if you're doing a medical degree or a healthcare degree, and you're taught about that in your biology teachings. But apart from that,
I'm going to ask a really tricky question to you now. You've got to forgive me. Actually, I want to bring up on the screen, there's some photos that these guys want to share with everyone. Whilst we have these photos coming up on the screen, I want to ask, Akil, I mean, for you to go out there and have these women come across, as the pictures will come up through, there we are, so that's you sitting with one of the, I mean, how was it for you to actually address such a topic to all these ladies? And if you could see the second picture coming up there as well, the conditions these people in, I mean, how was it for you? It must have been really difficult. Awkward.
Honestly, it was very awkward, and especially since they don't want to talk about it, it was even more awkward. But as you can see by the conditions, that's something
I have to ask you, this third picture which we're sharing with our viewers now, how did you get this picture? I mean, were these ladies not like, oh, what's this man doing coming taking these pictures of us?
No, because they saw us and we told them about MAA, listen, this is what we want to do. And they were more than happy. They're like, okay, you know what?
And I'm assuming that's a nurse there, or is she a doctor?
A consultant guy.
She's a consultant. Yeah. And this young lady, she obviously looks extremely shy. And you know, she's very reserved. There's no expression.
Because her mother-in-law was with her, and she was kind of nervous to speak about some maternal issues.
And it's what we spoke about earlier. You know, sharing these sort of things with your parents. You know, this young lady probably might have had a difficult pregnancy experience, but her mother-in-law's there, and she's not going to talk about it. Yeah. Wow. And what have we got? We've got two people here. Who are they that you met out there?
Okay, that's one of the nurses on the left-hand side, and on the right-hand side is part of the Bangladesh MAA team. She's a fifth-year medical student. Wow. And she's going around speaking to nurses, medical patients, doctors. But listen, we want to come in, we want to help through MAA.
So these are now students over in Bangladesh that are part of MAA Bangladesh, I'm assuming. And so they're on a similar course to you guys. Yes. They're out there to raise this awareness. I mean, oh my gosh. I've just looked at another picture. I hope we can share this. For those that don't want to look, I mean, this is... Akil, you tell everyone, please. This is the condition of maternity in Bangladesh. Yeah. Oh, well, I think I'd like everyone to have a look at that picture and, you know, just take a deep breath because, you know, comparing that to the UK.
You can sort of see there's a clear lack of sort of privacy. There's a clear lack of infection control, even when you look at that as well.
Yeah.
And just attending to these patients, you can see a lack of sort of support around them.
And, I mean, I know for a fact these pictures were taken naturally. This isn't an actress there making the most dull face. This is how she's feeling.
This is Echo, yeah. This is Echo.
Yeah. Have we got any more pictures on there? Sorry, I'm on both ways, up and down. But I mean, it's absolutely shocking for me to see some of these pictures. But this is the reality, isn't it? Yeah. And the involvement from men. Have we got? I mean, actually, if we have one more picture coming up, I mean, this is the involvement from the husbands coming up on the screen. And what?
Yeah, so some men are more willing to actually take their wives to the actual healthcare centres to actually get seen. Others would brush it aside, as you said. It's sort of a, we don't know what it is, let's just brush it under the carpet.
Wow.
So it's a sort of, you need to educate them and tell them about this.
I have to say, I mean, with our shows, we seem to try to stick along a plan of how we're going to talk about sort of topics. But I think looking at these pictures, I've completely lost my orientation. I might also ask you again, Akil. I mean, me as a complete lay, as a normal person, meeting you guys for the first time, seeing some of these pictures, it's really taking me back. Is this the sort of reaction you're getting from other people?
Honestly, the support we've been getting from other people have been incredible. We shared exactly the same pictures and they had exactly the same reaction as you. And I'm sure as the audience who's watching this right now, it's shocking and people are left speechless. And I've also had tears at the end of it.
Wow. Do you know what? I want to share this last picture that I'm looking at on my screen. Let me share that with everyone else there. This is the waiting area. I cannot believe I'm looking at this. And for those of you that have been to a hospital here in the UK in the waiting area, please, I'd like you to just look at that and compare to what you've experienced in the waiting area. I mean, we go to A&E and we moan, oh, it's been taking an hour, 2 hours for the doctors to see us. But my God, be in that condition, and that isn't any old waiting area. That's the maternal waiting area, isn't it? It's a labour unit to effect for Bangladesh. Gosh, if you're not worried about the conditions in Bangladesh, just looking at these pictures, I don't know what to say, honestly. You know, these guys around me, you know, Labib, I'm going to ask you actually, because the thing that I'm finding beautiful about the four of you around me is none of you are fathers. None of you are married, have I got that right?
Yeah, no,
yeah. I'm not going to ask about girlfriends, but none of you are married, none of you are fathers, and your experience of labour and maternity is quite simply through academia.
Yeah, essentially so. And you know, looking at these photos, you've only got to ask that simple question. You know, would you be happy if that was your ma, for example?
Wow.
And you know, that sort of underlines again some of the work that we're doing. Again, it's sort of basics. You know, having a look at the situation in some of these hospitals. A lot of the things we take for granted. You know, being born and sort of brought up in England, if you like.
Yeah. I'll tell you what I'm going to do. There's another video which we're going to let you see. It's a minute or so about some of the work that these guys are doing and maybe awareness to raise up. If I get my guys behind the screen, just let you have a view of this video. And yeah, I mean, there it is rolling there. Akil's just really introducing. Go on, Akil, dictate it away from me.
This is me now asking all students from all universities, regardless of the course, to come with Ma.
And this can be explained in three simple steps. Number one, we design the projects under the supervision of experts. Number two,
this is
we
sort
fundraise
of,
for
I mean,
the
it's a genuine pledge. We've got so many medical students out there. And to be honest, you're not even narrowing it down to Bangladeshis, are you? I think it's worthwhile. And I'm sure you agree with me, for other ethnicities to look at this. And I mean,
and also to hold simple
we've got a few more seconds of that video while that's running in the background. I just want to ask,
so if you're interested,
do you guys believe that there's other ethnicities out there that are... There was a video. I actually talking with these guys in the background of the video, but you got to hear the full audio of that video. So excellent. I hope that's giving you an understanding and an inspiration to it. Sorry, I should have warned you guys that we're going off air for that video to be played. But yes, as I was saying, I mean, do you feel that other regions in the world are going through this, or is this a Bangladeshi problem? I mean, because we know about the corruption. I mean, might be a tricky question, but give it a shot.
No, as we said from the offset, MAA isn't particularly focused in Bangladesh. We're aiming to help maternal health in resource-poor third world countries, and that includes Bangladesh, countries in Africa, Nepal, and like Hamadou mentioned, it's more as a community effort where we can all come together regardless of race, what course you're doing, what your work is, your social background. We're coming together to help tackle maternal health care problems around the world, and we're not limited to just Bangladesh. We started in Bangladesh because that's, as you can tell, close to our heart, but we want to expand and perhaps help everywhere maternal health is a problem and issue.
Thank you for that. Okay, I'm going to finish up with you because we've got 2 minutes to really wrap up. I want to ask you the question, and I'd like you to sort of finish with your pledge, because what's the ambition for MAA now? I can clearly see the audience have obviously been made aware, and it's an awareness raiser. Where does it go from here? What's the bigger ambition?
Our next ambition, our future goal, is making a maternal clinic, a fully functional maternal clinic that is run with the hygiene control is to the maximum. We have resources happening, you have teaching happening, educational classes happening in this maternal clinic, and that's the future goal. Our immediate future goal is this summer project, taking students from the UK and understanding the situation over there. As Labib said, that a lot of parents, they say that we'll never go back to Bangladesh in the future, and this is why I'm calling, this is why I want to ask the elders, the students, the children, everybody to come together in the UK and everybody to come together in Bangladesh to make this real goal of helping our mothers. And that's how I really want to end there.
Thank you for that. Gentlemen, it's been certainly an eyebrow raiser for me. It's certainly been something that I didn't expect, and I'm hoping everyone that's watched today, this past hour of Community Matters has really understood what these guys are doing, and I think it's a beautiful, absolutely beautiful idea to go through. I really want to wrap up this 1 minute by saying, I mean, we talk about the community, we talk about engagement, we've spoken about sports, we've had everything, but the one thing that you cannot pinpoint and grab is life. I think what these guys are doing here is marvellous. They've mentioned their Facebook, they've mentioned hopefully across the screen you've probably seen how to get in touch with them. I probably pledge for these guys. I mean, I've got nothing to do with them, but I would really pledge that you guys get in touch with them on Facebook. At least, you know, send them some questions across that might confuse you and you want to know a bit more about it. But let's all do our part. Let's do our part for mum. Let's do our part for life. This has been an inspiration, and certainly a show of inspiration to me. I hope you've enjoyed this too. Thank you for watching. I thank these guys. We thank King's College. We thank MAA in the UK, MAA in Bangladesh. And inshallah, if you take part and get involved, we thank you too. And
we love our fathers as well.
And the fathers as well. Everyone get involved. This is the end of the Community Matters show. I'm really sorry I didn't take callers, but questions, send them across to Facebook. I'll have another show in a month's time to talk about another topic. Until then, wassalamu alaikum wa rahmatullahi wa barakatuh.